The Interstellar Medical Academy on Centauri Prime was considered the finest healthcare institution in the known galaxy. Its gleaming bioregeneration chambers and quantum surgical suites represented the pinnacle of medical technology, accumulated over 12,000 years of advancement by 17 different species. Dr. Marcus Webb was the Academy's first human instructor, a position he'd earned after Earth's recent admission to the Galactic Medical Consortium. He stood at the back of the Advanced Trauma Center, observing as his students, a mix of Centauri, Krell, and Voxian medical candidates, conducted their practical examination. The scenario was straightforward: a deep laceration on the forearm of a volunteer patient, a young Centauri worker who had sustained the injury in a training accident. The wound was approximately 15 centimeters long and deep enough to expose muscle tissue, though it had carefully avoided major blood vessels. Student physician Zareth, a promising Centauri with iridescent skin and 6 delicate fingers, immediately began her assessment. Her scanner hummed over the wound, projecting holographic data into the air. Laceration severity, grade 4. Tissue damage, moderate. Recommended protocol, nanosurgical reconstruction with cellular regeneration therapy. Her Krell classmate, Throck, nodded his massive scaled head in agreement. Concur. We'll need the quantum suture array and at least 6 hours in the biochamber for complete tissue reformation. I'll prepare the anesthesia pod. The third student, a gaseous Voxian named Shimmer who communicated through a translation device, added their assessment. Psychological trauma index suggests sedation level 3. The patient will require memory dampening to prevent procedural stress. Dr. Webb watched as his students efficiently prepared for what they considered a routine but complex medical procedure. Robots wheeled in the quantum surgical array, a machine worth more than a small planet's GDP. The bioregeneration chamber began its startup sequence, filling the room with a soft azure glow. Anesthesia protocols were loaded, and the surgical theater transformed into a high-tech operational suite. The patient, a young maintenance worker named Keth, looked increasingly nervous as the preparations escalated. His skin shifted through anxious color patterns, deep purples and worried grays. Dr. Webb? Keth's voice trembled. Is all this necessary? It's just a cut. Before Marcus could respond, Zareth placed a reassuring hand on the patient's shoulder. Please don't worry. The procedure is completely safe. You'll be unconscious for approximately 7 hours, and when you wake, your arm will be perfectly healed. We've performed this operation hundreds of times. Marcus stepped forward, his weathered face thoughtful. Students, before we proceed, may I ask a question? The 3 medical candidates turned, surprised. Their instructor rarely interrupted practical examinations. What is the primary goal of emergency medicine? Marcus asked. Zareth answered immediately, as she always did. To restore the patient to optimal health using the most advanced techniques available. Not quite, Marcus said gently. He approached the examination table, pulling a small kit from his jacket pocket, something his students had seen him carry but never use. The primary goal is to stabilize the patient safely and effectively. Advanced doesn't always mean appropriate. He opened the kit, revealing contents that made his students recoil slightly: a curved needle, thin thread, antiseptic solution, and local anesthetic in a simple injector. Tools that looked positively primitive compared to the gleaming technology surrounding them. Dr. Webb, Throck rumbled, confusion evident in his deep voice. Surely you're not suggesting manual suturing? That's a technique from the pre-stellar age. We only studied it as historical reference. Marcus smiled. On Earth, we still use it. Not for everything, but for cases exactly like this. He turned to Keth. With your permission, I can close this wound in about 20 minutes. You'll be awake the whole time, just local numbness. No biochamber, no 7-hour procedure, no memory dampening. Keth's skin rippled with hopeful yellow tones. 20 minutes. And I can return to work. After a few days of rest, yes. You'll have a scar, but it'll fade with time. The students looked at each other, uncertain. Zara Th spoke up, her voice carrying a note of concern. But Dr. Webb, the quantum array provides perfect tissue reconstruction. Why would we accept an inferior result? Marcus began cleaning the wound with practiced efficiency. Is it inferior, though? Let's consider, your method requires expensive equipment, extended unconsciousness, significant energy expenditure, and ties up this entire surgical theater for hours. My method? He loaded the local anesthetic. Requires tools worth about 5 credits, takes minutes, and the patient walks out on their own. He administered the anesthetic with quick precision, waiting a moment for it to take effect. Then, with steady hands that had performed this procedure thousands of times in field hospitals and emergency rooms across Earth, he began to stitch. The students watched, fascinated despite themselves. Marcus's hands moved with mechanical precision, yet there was something almost artistic in the way he worked. Each stitch was perfectly spaced, the tension exact. He worked quickly but never rushed, talking as he went. In the field, you won't always have a quantum array. Equipment fails. Power runs out. Sometimes, the old ways are the reliable ways. He tied off another stitch. Earth medicine evolved in scarcity. We learned to do more with less because we had to. Shimmer's translation device crackled. But, the scar. Our way leaves no trace. Marcus glanced up, his eyes kind. Scars are proof of survival. They're not shameful, they're evidence that the body healed, that the patient endured. On Earth, we don't always erase our history. Sometimes we wear it. 15 minutes later, Marcus tied off the final stitch and applied a simple bandage. The wound was closed cleanly, the stitches neat and functional. Keth flexed his arm experimentally, amazed. I can feel it, but there's no pain. And I'm done. Done, Marcus confirmed. Keep it clean, come back in 10 days to remove the stitches. Avoid heavy lifting for a week. As Keth left, expressing profuse gratitude, the 3 students stood in silence, surrounded by their unused high-tech equipment. The quantum array powered down with a disappointed hum. Zara Th approached the examination table, studying the neat line of stitches. Dr. Webb, I have to ask, if human medicine is so simple, so efficient, why did it take your species so long to join the consortium? Marcus smiled as he cleaned his tools. Because we were too busy making sure everyone could access care, not just those who could afford quantum arrays. We learned that the best medicine isn't always the most advanced, it's the medicine that's available when you need it, performed by hands that care about the result. He held up his simple needle and thread. These tools have saved lives for thousands of years. They'll save lives for thousands more. Technology is wonderful, but skill, knowledge, and compassion. Those are universal. Throck rumbled thoughtfully. Perhaps there is wisdom in simplicity. Perhaps there is, Marcus agreed. Now, shall we discuss why 7 hours of unconsciousness might be excessive for a simple laceration? I believe we have much to learn from each other. As the advanced equipment was wheeled away and the students gathered around their human instructor, a new appreciation dawned in the gleaming halls of the Interstellar Medical Academy. Sometimes, the most advanced civilizations had something to learn from those who had mastered the art of doing more with less. And sometimes, the most profound healing came not from the most sophisticated technology, but from the steady hands of experience and the simple tools of proven practice.